Let's jump right in. Navigating behavioral health and addiction treatment, yeah, it's completely overwhelming. And when you throw insurance companies into the mix, it feels like an uphill battle. But today, in this explainer, we're giving you the ultimate playbook to understand your coverage and actually fight back when you need to.
Have you ever received a massive, surprise medical bill right after a major crisis? Or maybe you've been told flat out that your addiction treatment just isn't covered. Look, it's a terrifying moment. You're already dealing with a vulnerable situation and suddenly, boom, a huge financial roadblock drops right in front of you. It stops so many people from getting the vital help they need. But honestly, it absolutely doesn't have to be this way.
So here's our game plan for today. We're going to break this whole intimidating process down into 5 clear steps. We'll cover knowing your parity rights, the ultimate verification checklist, understanding coverage versus authorization, the No Surprises Act, and finally, how to file an internal appeal. Basically, we're building up your armor before, during, and after treatment.
All right, Section 1, Know Your Parity Rights. Let's talk federal protection.
Have you heard of the Mental Health Parity and Addiction Equity Act? It's been on the books for over 15 years now. Basically, it's a federal law that stops insurance companies from discriminating against people with mental health or substance use disorders. Simply put, if your health plan covers something like a broken arm or diabetes, they are legally required to cover substance use disorders and mental health in a totally comparable way. They can't just give you unlimited doctor visits for a physical issue, but then arbitrarily cap your necessary therapy sessions. In practice, this is all about balance. Health plans absolutely cannot impose more restrictive visit limits, slam you with higher cost sharing like massive copays, or demand crazy prior authorization hoops for behavioral health compared to standard medical benefits. Think about it. Imagine if your insurance covered unlimited visits for a broken leg but capped your therapy at 10 sessions. No way. That is exactly what this law prevents. So if you're facing a discriminatory or restrictive coverage denial, remember you have federal law on your side to challenge it. Period. You have rights, and it is absolutely critical to speak up when you're denied legally mandated care.
Moving right along to Section 2, the verification checklist. It's time to arm yourself for battle.
Now, care isn't just one size fits all, right? It ranges all the way from early prevention to specialized treatments like residential or intensive outpatient care and stretches right into long-term recovery support. You can't just call up your provider and vaguely ask, hey, do you cover rehab? You really need to know exactly which specific slices of care your policy covers. Why? Because insurance companies categorize and fund every single one of these stages completely differently. So to do that effectively, you need a rock-solid verification checklist. Grab your insurance card, call the behavioral health number on the back, and ask these very specific questions. First off, confirm exactly which treatment levels are covered: detox, residential, IOP. Next, ask specifically if your plan requires prior authorization for those different levels of care, because missing a prior auth is a fast track to an automatic denial. You also need to identify your total out-of-pocket costs, including deductibles and max limits. Ask the provider directly about their in-network versus out-of-network status. Guessing here can literally cost you thousands. And finally, inquire about any session limits or length of stay parameters for addiction services. Asking these specific questions up front prevents catastrophic financial surprises later. But wait, just asking isn't enough. You must always, and I mean always, record the representative's name and a reference number during every single insurance verification call you make. And this is crucial. Request written summaries of all confirmed benefits. Seriously, do not just accept verbal assurances over the phone. Demanding a reference number and a written summary sent to your email creates a solid paper trail. It's hands down your best defense to prevent future billing disputes.
Okay, let's head into Section 3, coverage versus authorization. You really need to know the difference here.
There is a massive difference between theoretical plan coverage and specific medical necessity authorizations. And honestly, this is the single most common point of confusion for families. Just because your plan covers residential treatment in theory doesn't mean they've actually authorized it for your loved one. Think of it like this. Coverage is the broad umbrella policy saying, sure, we offer residential treatment. But authorization, that's the specific key turning in the lock, clinically approving your loved one for that specific facility for specific dates based on an assessment of medical necessity. Without that authorization, the treatment might be covered in theory, but it absolutely will not be paid for in practice.
Which brings us to Section 4, the No Surprises Act. Think of this as your second federal shield.
Imagine the absolute relief of knowing you won't be bankrupted by a medical emergency.
That's where the No Surprises Act comes in. It's a federal law designed to protect you from unexpected balance billing from out-of-network providers. What's balance billing? That happens when an out-of-network provider bills you directly for the difference between their crazy high charge and what your insurance actually allows. If you unknowingly or unavoidably receive care out-of-network during a crisis, this law is specifically designed to stop them from sending you a massive surprise bill.
So, what exactly does it cover? Well, it applies to most emergency services, including acute mental health emergencies. But it also protects you in those sneaky situations, like getting non-emergency care from an out-of-network provider while you're recovering at an in-network facility. It covers out-of-network air ambulance rides, and crucially, it completely bans balance billing for ancillary services, like anesthesiology, pathology, or radiology. You can actually use this powerful law to contest billing errors, ensuring your payments only ever count toward your regular in-network deductible and out-of-pocket max.
Now, while we're talking about protecting yourself, we have to mention the dark side of things. It is incredibly important to be aware of fraudulent practices out there, like patient brokering or the Florida Shuffle. This is a completely predatory scheme where you or a loved one might be offered free travel, free rent, or other perks in exchange for your insurance details. Why? Just so they can run up fraudulent claims at specific rehab facilities. Honest programs are 100% transparent about costs and will literally never pay you to enroll. Guard your insurance information very carefully.
All right, Section 5, filing an internal appeal. Time to talk about fighting back.
So, what happens after treatment if the insurance company just flat out says no and denies your coverage? First things first, you have to know the difference between an explanation of benefits, or EOB, and an actual medical bill. An EOB comes directly from your health plan. It's essentially a breakdown telling you what services you got, what the insurance is paying, and what portion you owe. A medical bill, on the other hand, is the actual invoice generated from the provider's office. Here's a pro tip. Before you ever pay a medical bill, check your EOB first. Look closely. Did the plan deny an item that should actually be covered under the No Surprises Act or the Parity Act we talked about earlier?
If you spot an error, or if your insurance denies coverage unjustly, here is exactly how you file an internal appeal. Step 1, read your EOB super carefully so you understand the exact reason for the denial. Step 2, pick up the phone and call your plan directly. Ask for a copy of their internal appeals procedure and find out exactly what clinical information or documents you need to prove medical necessity. Step 3, submit your internal appeal in writing. Your plan is legally required to review it and respond promptly. Remember, a denial is often just the beginning of a negotiation. It is not the final word.
So, let me ask you this. Armed with the Parity Act, the No Surprises Act, and your complete verification checklist, what are you going to do the next time an insurance company tells you no? The healthcare system is incredibly intimidating, no doubt about it. But with this foundational knowledge, you are totally empowered to demand the care you or your loved one legally deserve. You have the shields, you have the checklist, and now you're ready. Thanks for joining me on this explainer. Keep fighting the good fight.